I'm Mina Malik Hussain and you're watching The Coffee Table. I feel like this whole sort of past year with the COVID and everything has been a year where we have tried to take care of ourselves, and we've, as you have noticed, have a lot of shows on a lot of cosmetic procedures that are actually really interesting to talk about. It's not only are we giving you information, but it's interesting too. Everybody learns on The Coffee Table. Today on the show, we're going to be talking about platelet-rich plasma therapy, which is a fascinating and slightly gory sounding procedure. So it's going to be really interesting to unpack what the therapy is, what does it mean, what is the procedure for, lots of different and myriad uses, you'd be surprised to know. We are delighted to be welcoming back on the set our friend, Professor Dr. Khalid Hussain, who is the head of the Orthopedic Surgery Department at Rashid Latif Medical College and RF Memorial Hospital, where he is also a professor of orthopedics and is a consultant at Doctors Hospital here in Lahore. And joining us today on set is Professor Dr. Farid Ahmad Khan, who is a professor of cosmetic plastic surgery at Al-Razi Hospital and SurgiMed Hospital and Services Hospital. There's accomplished doctors on set. Thank you so much for taking out the time, doctor. It's a pleasure to have both of you here.
Thank you.
I'm always really happy in COVID when people can come on the set.
That's right.
It's just the energy is totally different.
That's right.
So I want to sort of begin at the beginning. So Dr. Farid, when we talk about, so PRP is now a fairly common procedure now and addresses different things. But before we get into that, what does it mean? What is the plasma? Where does it come from? What is that?
As you know that our blood has got fluid and cells.
Right.
Now cells are of three types. One is red blood cells, the other one is white blood cells, and the third one is platelets.
Oh, okay.
So red blood cells would carry your oxygen.
Yes.
White blood cells would be your defense mechanism, and they take care of immunity and allergies and possible side effects as well. And platelets would be responsible for clotting of your blood.
Oh, okay.
So and platelets, in addition to doing clotting, have got few growth factors which are responsible for our rejuvenation, neo skin, neo growths, regeneration of different other tissues of the body as well.
Oh.
When we found out that, we tried to extract platelets out of those two irrelevant materials of blood, which were
extras.
RBCs and WBCs, or red blood cells or white blood cells. So we took them out by a process of spinning, which is in our term called centrifugation.
Yes.
And then that plasma or the fluid part, which remained, now only contained platelets and growth factors. Thus, it became rich enough to be called as platelet-rich plasma. And the abbreviation is PRP.
PRP. So I believe that there are also there are rich platelets and then there are poor platelets also.
That's right. That's right.
So what are poor?
You seem to be well informed about all medical terms.
Lots of notes.
In fact, when we centrifuge it once, only the white blood cells and red blood cells get separated.
Right.
When we centrifuge it again, there is part of the plasma which is now devoid of everything.
Oh,
it's just poor. It does not contain any platelets anymore.
Oh, so it's just liquid.
That's right. This is called PPP or platelet poor plasma. Don't confuse it with the political party. The second is PRP. Now this is the richer portion because it contains platelets.
So it's a super concentrated component, it's super concentrated plasma from one's own blood.
That's right. And the benefit is that since it is devoid of your WBCs, it won't cause any allergy or anything which is injurious other than infection, which could occur if it is done in an unsterile environment.
Yes, we're going to come back to that in a minute. But Dr. Khalid, I also believe that PRP, we now sort of use it for a lot of cosmetic procedures, but PRP therapy has been in use since the 80s for a lot of muscular injuries.
Yeah. It was initially used for the rotator cuff injuries.
Right. What are rotator cuffs?
Rotator cuff injuries. Rotator cuff injuries are shoulder muscular injuries.
Oh, okay.
You see most of the patient who have frozen shoulder and pain in the shoulder joint. So initially this was used for that. And then it was used for Achilles tendonitis, tendons of heel.
Oh, okay. So down here. Okay.
Yeah.
So because, and I assume it's because that these growth factors then help in rejuvenating torn muscles and putting things back to
Exactly.
a lay person. I'm like,
Exactly.
healing.
This platelet factor is usually it attracts fibroblasts. Fibroblasts are the cells which form collagen.
Oh.
And collagen is the basic tissue which forms tendons and muscles.
Yes.
So concentrated platelets, they attract more fibroblasts, and there is a more healing at the site of injury.
Oh,
Usually it is used in chronic injuries, not acute injuries.
Okay. Well, chronic injuries are then long-standing, long-term injuries.
Long-standing wrist, elbow pains, which is called tennis elbow or golfer's elbow, or in wrist pain, in plantar fasciitis.
Yes.
This is commonly used in these.
Oh, so it's basically that's magical potion.
Yeah.
So you have collagen, and collagen, from what I understand, is the sort of holy grail of skincare also. Because I'm greatly involved in Korean skincare now, and everything is about collagen this, collagen that. Boost your collagen, because you can't. Is it true that can you eat things that help you produce more collagen?
Yes, you can.
Okay.
And I reiterate your fact that the Korean and Chinese skin is probably the best skin of the world.
Yes.
And Mediterranean, mainly Mediterranean region and that region. And what you normally undergo in cosmetic clinics these days, like different type of lasers and different type of treatments, they all induce collagen in your subcutaneous tissue. That's why they claim that they can produce, but that is a non-invasive method.
Right.
So that's a very small gain. But if you move from there to PRP, that is a minimally invasive procedure, generally painless, because we either numb the skin or we inject local anesthetic, so you're completely relaxed. And
Except for the anesthetic.
It's not general anesthetic at all. It's just the local numbing creams and all that stuff. And one thing very important which I want to say here, that the technique of preparation of platelets. Normal platelet count in our blood is about 1.5 lakhs to 4 lakhs around.
Okay, which is a lot or not that much?
It is the normal range.
Okay, sounds like a lot.
It is 6% of your blood cells. It has to be more than 90% of your blood cells in order to be called as rich, platelet-rich plasma.
Oh, okay.
So it has to be more than 1 million at least. So that's why technique is very important. So it's not essential that you just label that this is platelet and just inject it.
But there's no real way of knowing, is there? You just have to trust that the person doing the procedures is
Trust
doing it right.
is the basic thing. But in our profession, they say it's the most sacred of the profession, but meanest of the trade.
I like that.
The person who is using PRP and he is using rich plasma, one, he is giving benefit to the patient.
Yes.
And the other, he is giving benefit to himself.
Yes.
Because
that's true.
If he injects more rich plasma, patient will heal properly.
Yes.
Heal earlier.
That's true, and have good results.
Have good results and have a good name.
That's true. Motivation to be an honest person. So, Dr. Khalid, are we doing PRP for muscle injuries here in Pakistan? Is that something that we're doing?
We are using that in chronic muscle injuries. The most common is tennis elbow, which is common in tennis players. There is a pain on outer side of the elbow, and the patient comes with a severe pain. And we inject this PRP in their elbows, and after 3 to 4 days, he has a little pain.
So it improves, and you've seen very good results.
But gradually, in 4 to 6 weeks, he is healed. He is all right.
Really? It's that drastic in a sort of month and a half?
Previously we use steroids.
Oh.
But steroids had a lot of side effects.
Quite right. And they have to be used very carefully.
Yeah, and have to be used because in diabetics, if you use steroids, their diabetes is uncontrolled.
No, but that's fantastic. Do you need, Dr. Farid, do you need to draw a lot of blood to get that high concentration of
Not really. It's only usually 20 to 30 mils of blood, which is nothing.
But how much? Like for a lay person, so when you go to get a blood test and sometimes they do it in that little test tube. So about that much?
Double that amount.
Okay, so sort of 2 little test tubes. But that's not too bad. That's like a full blood checkup.
About 30 milliliter of blood.
Remember that you've got about 5 liters of blood.
Yeah, so
and it is considered healthy if you donate about 500 mils every year or every 6 months.
Yeah.
So it's not a huge amount at all.
Quite right. And so, for example, so if I were to come to your clinic and say that I wanted this PRP done, so first you would start with drawing blood.
That's right.
And you'd have your 2 little test tubes. Then you'd pop it in your centrifuge.
No.
Okay.
The important thing is that since I told you that these platelets would cause clotting of blood, so you have to have an anticoagulant added into that tube.
Oh.
That is important. Otherwise, all blood would be clotted.
Yes.
Then you would put them in centrifuge. And there are different revolutions. Like generally we do it first spin, which is called soft spin, at about 1000 RPM, which is revolutions per minute. It's more technical, but for about 10 minutes. And then that 2 gradients would come. Strictly speaking, 3 gradients. One is called Buffy coat. The top is the plasma and the bottom is the blood.
Right. Okay.
So then you take out that plasma and part of the Buffy coat and spin it again.
Right.
That's called hard spin.
Hard spin. And how long does that take?
That takes about 15 minutes more.
That's not
so
bad.
Normally it's half an hour procedure. And then in the meantime, we do it strictly in theater conditions. Remember, don't take it lightly. Do not get it prepared in ordinary rooms where there is no sterilization and nothing of that sort.
But then that means that PRP should be done in a hospital? Not in a clinic, but you can have theater conditions in a clinic.
Please remember, that is the right spirit.
It should be in sterile environment.
Sterile environment is the prerequisite.
So if, as a patient, what kind of questions can I ask to make sure that the place I'm at to have this procedure is sterile? Okay, is there a way that a patient can sort of check? What kind of questions should one ask? Can I see your equipment, or what are you using to sterilize?
I mean, probably trust is the most important part in our profession. But in general, you need to see where your process is being done. If it is a mini sterilized, clean theater with a little bit of sterilized facility, like usually labs have got a little sterile corner.
Yes.
You know that. But it shouldn't be like a just come and go procedure just straight away. The other thing to measure is that now these days people are using stem cells. Now that is a thing of the future. That is called regenerative plastic surgery or regenerative medicine. That is a different branch of medicine, and imagination is the limit where you can go. But remember that stem cells is not PRP. These are 2 different conditions.
Tantalizing. We're going to take a very quick break here, and you'll have to stay with us to find out why PRP is not the same as stem cells. Stay with us. We'll be back. Welcome back to the coffee table. We're having a fascinating conversation about PRP therapy with Dr. Khalid Hussain and Dr. Farid Ahmad Khan. So before the break, we were talking about how stem cell research is a sort of parallel approach to PRP as well. So it's a sort of 2-pronged, amazing science.
And that's right. What you were alluded to was how could we assess that whether stem cells are being given to you or not. First of all, I tell you what stem cell is. It's a very interesting concept.
It is.
In fact, what we are, we were one stem cell right from the beginning. So stem cells have got different lines. They are called progenitor cells.
Right.
So one stem cell would proceed to your bones, the other one to your cartilage, the other one to your hair, and all that stuff. So if you can produce few stem cells now, wherever you inject, they would grow to that particular organ.
So they turn into the cells in that area.
Perfect.
Particular environment.
Okay, depending on the environment.
Depending on the environment.
That's fantastic.
Now the source of stem cells is not blood.
Yes.
So it is either fat or bone marrow. But since we do liposuction, fat is the easiest source of taking stem cells. But there is a process involved in which there are either enzymes or mechanical process and a lab involved where those stem cells are augmented. And now what we are doing is we are injecting PRP plus stem cells taken from your fat to your hair and to your skin.
Wow, it's almost coming from you.
That has got double the rejuvenating effect. In fact, there is very anecdotal evidence that PRP sort of done wonders. No, it doesn't.
Really? So it's not a kind of done deal that you got your PRP
not at
and
all.
now you have this lush head of hair.
Not at all.
Really?
If somebody is saying to you, he's lying. Because PRP is an intermediary product between non-invasive treatment of your skin and hair and hair transplant.
Yes.
So it cannot replace hair transplants at all.
So when we're talking, and I'm glad that you sort of have come to this organically, is that when we talk about hair loss, then PRP and hair transplants are the two kind of most popular approaches to it. So I'm glad that you brought us organically to hair transplants. But before we talk about hair transplants, I want to just talk a little bit about hair loss itself. So what is the difference between a normal sort of rate of hair fall? Because I believe it's normal for about 100 hairs to fall off your head every day. But how do you know that what is normal hair loss and what is balding?
Right. There are about 60 to 80 centimeters square area of your hair on your scalp. Now, that 1 centimeter square quantitatively would have about 100 to 120 hair in a normal person. Now, there is a classification which would tell you how much bald you are. It's called Norwood classification. So Norwood 7 is completely bald and Norwood 1 is when there is temporal recession.
Yes.
Now, there is one type of baldness which is more in males.
Yes.
You would see that their frontal hair gets receded.
Which is the temporal, because that's this area, isn't
right.
it?
Frontal and temporal area.
So it's sort of like
that's
that
right.
sort of loopy M
That's
shape.
right. But in females, the pattern is different because it is not related to the hormones.
Oh.
Right. And now there are few treatable causes of hair loss, which we must stress upon and must allude to.
Yes.
First is dandruff. And you must seek a dermatologist's opinion because it is a treatable cause.
Yes.
And the second is anemia or iron deficiency.
Which we have a lot of. Lots of people are iron deficient.
That's right. And the third, which is probably not treatable to 100%, is stress.
Stress really sort of does
That's
all.
right. That's right.
It's just a big problem. So dandruff is also, it does contribute to baldness.
Oh yes, remarkably.
Oh wow! Because first one thought that maybe it's just a sort of old wives' tale, but it's true.
Not at all. And then there are few vitamins, folic acid, and most important is biotin.
What's biotin?
Biotin is one of the vitamin Bs.
Yes.
Which is responsible for stimulation of your hair bulb. There is a hair root and a hair bulb. Hair basically grows from hair bulb.
Yes.
Please remember that any treatment would not grow your hair from an area where there is no hair root. So if you put PRP on your forehead,
where there is there's no hair there.
Right. So you have to have a hair root. It is called nascent hair.
Right.
That your root is there and then you stimulate it somehow.
Oh, okay. Well, that makes a lot of sense because obviously if it's a hairless place, you can't just magically make hair grow there.
That's
But isn't biotin also good for collagen?
Oh yes,
stimulation?
It is one of the vitamin B complexes, which is good for all of you. All of the collagens and your rejuvenation and everything. But remember that there has to be a mechanism.
Yes.
You must first get your vitamin level checked before getting that.
Yes.
I mean,
you can't just
now
take
it is
the vitamins.
evidence-based medicine. Now people say that Pakistani people's urine is the richest in vitamins because they take enormous amount of vitamins and then that gets excreted through your
My
urine.
goodness. But
So
Dr.
if you are
Khalid,
taking a balanced diet,
No.
there's no point getting that.
Oh, then you don't. If you have a balanced diet, then you don't have to take supplements. But biotin would also help for bone trouble, wouldn't it? Would taking biotin help in the collagen of your joints and your bones also?
Yeah, it also because biotin increases the collagen formation everywhere. Wherever there is injury, biotin will be helpful there.
So it's sort of, sort of a two-pronged approach. Everything will be better. So, Dr. Farid, so how do you know that your hair fall is now that you are becoming bald? Because I feel like a lot of people are anxious about this, and people feel like, oh my God, I have a lot of hair fall, but it doesn't mean that you're going bald, does it? New hair does keep growing as well. But how do you know that this is now turning it, like, if like in women, for example, if you say that my parting is becoming wider, does that mean that is balding, or is it just age and
no.
weak hair?
Female, when their parking becomes wider or their crown is visible.
Right, so this
That's right. That means that they're started balding now.
Okay, so that's serious.
That's right. I mean, what is serious and what is not is probably your wishes and is a relative term. But in general, then there are, remember that hair growth is $1 billion industry in this world. And there are only 2 documented products which are medically recognized for hair growth.
Yes.
Please remember that.
Yes.
And one is very interesting, which is called Minoxidil.
Old-timer Minoxidil.
That is. Professor Khalid recognizes that as well because Minoxidil first came as a blood pressure lowering drug.
What? But how did it become a hair thing?
And then when they did an experiment on it, they found that those who took it for blood pressure lowering, in fact, hair growth occurred on their body as a side effect. So they thought that
there are many drugs like this. That's Viagra. Viagra was basically heart medicine.
Really?
Yeah.
Wow. But that's good news for drug companies. You repackage it and you sell it as something else.
They are doing.
That's fascinating. So, Dr. Saab, what are the benefits of PRP?
The benefit of PRP is that it is your own blood. It is taken from yourself, so it doesn't have any reaction.
And then, I suppose, no, but you're right, because if you had a reaction, what would that reaction be? Like itching, or you sort of get a rash, or?
If you have a reaction, then it will be itching, there will be rash, there will be blood pressure will be decreased. So many problems.
So it is serious.
But because PRP is filtered from your own blood, so it doesn't react. And the only problem which with PRP can occur is infection if it is not centrifuged or it is not taken in sterile environment.
So if you don't centrifuge it properly, why would you get an infection from that?
No.
No.
In proper environment.
Okay. So if it's not a sterile environment, then on the location where you're getting injected, then that could cause an infection.
If that is not sterilized, the location where it is being injected, if it is taken from the area where that is not clean.
So, Dr. Saab, what causes hair loss in the first place?
As I told you that there are few causes which are treatable and few which are not treatable.
Right.
Like the most important cause in men is in fact the male hormone. It is the testosterone. And once, if your testosterone is deficient, you would have a lot of hair.
Oh, how
So
interesting.
it is the opposite.
Oh, so low testosterone levels make you more hairy.
That's right. So that is why women ratio of becoming bald in women is much less because they have got causes other than androgen production. You understand?
Yes.
That is why one of the products, the second product which I was alluded to,
Yes.
is in fact one of the medicine which reduces the amount of testosterone. That is why it is very important to get your hair treatment from a good consultant who understands what he is giving to you and why.
Because then you're meddling with your hormones,
I
and if
agree.
it's not monitored correctly, then
That's
that could cause a lot of trouble.
So true.
Oh. So when we're talking about PRP versus a hair transplant, how are those two procedures different?
PRP is, would I honestly tell you, if you say that there are 15 hair per your square centimeter, PRP would increase that density from 15 to 25 maximum.
Which is good.
Which is good, but not excellent. And on the other hand, it gives you two more effects. One, it would strengthen your hair. And second, it would grow some new hair as well.
Right.
Hair transplant is a complete different technology. Now what we are using is a follicular transplant. So there is no incision, there is no stitch at all.
Really?
With a machine, we take out individual follicle.
From other parts of one's body?
No, from the part which is back of your...
Okay, where you have hair.
That's right. You remember that these hair are genetically determined to stay. So
What? Really?
if there is...
So this is like, permanent hair.
Remember,
genetically.
your grandfather, if they are bald, they always have got this part remaining.
So your body holds on to this hair, but this hair is variable.
That's right. That is why if transplanted correctly, these hair would remember that genetically they have to stay.
So if you take follicles from there, then your scalp will just grow back hair from there. And it's
From
fine.
there, and these hair would remain here longer than your natural hair here.
Because it's that programmed follicle.
It's the genetic memory.
Oh, that's fascinating. But the thing is that once a hair permanently falls out, and that is a bald spot, and hair no longer grows there, there's no way to kind of produce hair from a spot that is just bald now. Does that mean that the follicle is just closed?
That's right. Now, what happens
Look at
is...
me, I'm almost a quack myself.
What happens is that when we take out a follicle from there, we are not taking hair shaft. We are taking, in fact, the root and the bulb of hair. And when we put it, even on any area where there is no root left,
Yes.
or hair is in anagen phase, I mean, it's in dormant phase, that hair would grow.
Oh, so it's almost like seeds, sort of planting.
It's exactly like planting seeds, because then the rudimentary top shaft would shed off, and new hair would grow at about 4 to 6 months' time. So that is a different science. It could cover your head completely in one mega session. While PRP, generally we recommend 4 sessions at a monthly interval, and then 2 sessions at 6 months and 12 months. So PRP sort of in grades, it is if out of 10, I'll give it 2 marks. PRP plus SVF for stem cells, I'll give it 5 marks. I'll give distinction to hair transplant with 8 or 9 marks.
The golden star. We're going to take a very quick break here, but stay with us. This is a wonderful conversation. We'll be back in a minute. Welcome back to the coffee table. We're having a fascinating conversation with Dr. Khalid Hussain and Dr. Farid Ahmad Khan about PRP and its various applications, in medicine and cosmetics and all sorts of wonderful body improving things. So, Dr. Khalid, do you think that PRP is also a good alternative to treat muscular and, sort of kneecaps and things like that, as opposed to having to take medication over a long time or having, things replaced in your body?
Yeah. because while you are taking medicine for the long time for the pain of muscle injuries, etc., there are side effects of the medicine as well, which can create injury to your stomach, to your kidneys, etc. So PRP doesn't have any type of that reaction.
Yes.
So it is better if a patient has a tennis elbow and he comes to you for treatment. Other than giving him medicine, you just give him PRP, and in 4 to 6 weeks he will be all right. He might be needing a second session as well, but he will be all right. And especially when you give the patient PRP, medicines are prohibited.
Oh, but that's pretty good, isn't it?
Anti-inflammatory drugs are prohibited then. Don't give them anti-inflammatory drugs.
Right. Okay, because then that will inhibit the effectiveness of the PRP.
The other thing which we are using, I've already told you, they are steroids.
Yes.
We are injecting steroids in tennis elbow, in golfer's elbow, in plantar fasciitis, in Achilles tendinosis. Steroids have their own side effects. So this PRP doesn't have any side effect.
Yeah, so it's actually a really effective therapy for these conditions.
For these conditions.
Well, that's wonderful. And not having to take painkillers over a long period of time. And do you find that with PRP, it has a very good results in rejuvenating muscles and cartilage?
It is questionable. It is questionable. But people are using, doesn't have enough literature support for that.
Okay. Yeah. But there are no sort of side effects either, and if it does help even a little bit.
It is being used for doping.
Oh, PRP?
Anabolic. They say that it has effect of anabolic steroids.
The conversation has taken a serious turn. So, Dr. Farid, I wanted to ask, how would one know whether one is a good candidate for PRP or a hair transplant? So, how would one sort of know which to choose?
Depends how much hair are important for you. But jokes apart, I think we don't do hair transplant at a very early age.
Okay. So what do you mean by early?
Means less than 25 years.
Okay.
And the reason is that if you do hair transplant and don't remove the cause of hair loss, what he would do is he would continue shedding his hair, and there would be a step ladder pattern of your transplants and his shedding of hair. You understand?
Gosh, so if you transplanted here, the hair at the back might just keep falling off, and then there'll be
falling off. So the frontal line would be there, which you have transplanted, and rest would shed off.
Yeah.
There is no upper age limit. But there are few risk factors like smoking, anything which causes a constriction of vessels. Obviously, you need more blood supply there.
Yes.
The important thing is that, like all other things in the world, there is a specific finesse involved in transplant as well. For instance, the best hair transplant is when you can't feel or see whether hair transplant is being done or not.
But it just looks very natural.
That's right.
Do you think that at a certain age, when people experience, generally with age, one's hair does become thinner, and that's just a process of aging? So do you think that PRP is an effective way to kind of maintain your hair?
That's right. When your hair are thin, but their quantity is not sufficiently less, then PRP and stem cell therapy or SVF is the answer. But once you have gone past that stage, then obviously transplant. But transplant has got no comparison. What we're doing now is we get transplant along with PRP.
Oh, okay. So you're sort of rejuvenating the hair you already have and then sort of filling in the gaps.
That's right. And the one you mentioned earlier on, the platelet-poor plasma, we dip our hair to be transplanted in platelet-poor plasma so that they keep on getting nourishment.
So there is a use for it.
That's right. Everything has got a use.
So now I also know that, I know so many things it seems, that PRP is also used for skin treatments.
Oh,
and I feel like that the vampire facial that has gone really viral on social media, and a lot of sort of famous people do that. So what is that?
Now there are different funny names given to a very simpler techniques.
But you might have heard
Nefertiti facelift.
Oh, I haven't.
Nefertiti, as you know,
yes,
was, and she had a very fine jawline. So when we make that, you call it as a Nefertiti. Vampire is another interesting thing. What we do is we just sprinkle PRP on face and then we have got micro needling or we do derma roller.
Right.
So the aim is that you injure the top skin so that the bottom collagen gets regenerated.
Oh, because your skin is like, oh my goodness, I need to heal now, and starts producing collagen.
And then PRP with its growth factors would rejuvenate your skin. So it is very good treatment for your pigmentation. It is very good for rejuvenation, for freckles, for generally getting your skin toned up, because you have done two procedures. One, you have stimulated collagen.
Yes.
And second, you have give nourishment to the skin. That is called vampire facelift.
Does it hurt? Does PRP generally, like, you know, if they're injecting things in your scalp, does it hurt a lot?
Now, in cosmetic surgery, there is no concept of pain and hurting, because if it is so, nobody would come to us.
Well, you know, no pain, no gain. Some people are invested in that. But Dr. Khalid, when you use PRP...
In my experience, when we use PRP, at the time of injection, we use local anesthetics, and that is not painful. But after 3-4 days, it is painful.
And because I imagine that you have to inject it much deeper.
A little painful.
So for muscular things.
Yeah, and another 2 to 3-4 days, it remains painful. Then gradually, pain weans off.
Right. So, so it depends on where you're using
Dr. Khalid, as he has very rightly mentioned, we've got now short-acting local anesthetics and long-acting.
Yes.
So what we do is we combine them together so that the long-term pain is also settled. Sometimes what happens is that you get a helmet type of anesthesia for a couple of days, because we give them local and they don't feel their scalp for a couple of days till their pain is over. So that's a good feeling too.
You can tolerate the pain in your arm, but you cannot tolerate the pain on your face.
This is true. This is actually true. It's true. So sort of coming back to these vampire facials, this is also because some bloggers have done this at home, but because, you know, you get a derma roller, you sort of roll it on your face, and you get a lab technician to draw your blood, and then you just sort of rub it on your face. But that's not something that you should be doing.
I think that term "don't try it at home" probably holds true for this as well. Now, in the best use of PRP, what I have noted is that is the dark circles, which is very common in our part of the world, because pigmented skin is much more prone to having dark circles around the eyes and stuff, and when your fat gets atrophied. And this is the area where you can't do HIFU or can't do lasers or can't do much. PRP, if you fill it under the eyes and under the lids, and it is produced to produce the eyebrows lifted a bit, and it not only rejuvenates but also reduces your pigmented eyes, and that is also part of the vampire facelift. What we generally do is, an hour before getting treatment, we put a specific cream, which is called EMLA. It is eutectic mixture of local anesthetic. So it numbs your skin. Then we use all measures like ice, like vibrators, and then we inject local anesthetic. And what I generally use is I put nerve blocks.
Oh goodness!
It's
a very complicated procedure.
The success of a good cosmetic procedure is that it should be painless and it should remain painless.
Yes.
And then you very slowly do the injection of PRP or microneedling or derma roller or whatever. Derma roller, I think you can use at home, probably, but I won't recommend it.
Okay. So, Dr. Saab, in closing, do you feel like PRP is a treatment that is sort of quite suited to South Asian skin? Do you think it really suits us to have to take that approach?
That's right. We've got much thicker skin. But my recommendation would be when you are injecting PRP, in Caucasian skins where I worked as well, we used to inject quite superficially because their skin thickness is much less. But in here, if you inject at the right plane, I think that is the treatment of choice in specific conditions, provided you go to an authorized person. That is very important. People say that quacks are more dangerous than earthquakes because now this practice is so much going into malpractice that every corner you see a cosmetic clinic going on. That is to be taken care of, and you need to assess that if you can go to 3 places to buy a piece of cloth, you don't assess somebody and just go there. And whenever you're going, just please assess it and don't say that how many followers he or she has on social media, because usually professional people don't like to project like that.
Yeah, Dr. Khalid is smiling. He's like, yeah, no.
Dr. Farid is saying that man behind the gun is very important.
Yes, absolutely. Thank you so much, both of you, for joining me today. This is such an interesting and multifaceted conversation about PRP. I've learned many things, as I always do. Thank you guys for watching. If you're watching this on YouTube, don't forget to like and subscribe, and we will see you next time on the coffee table. Bye now.